You're holding a small, yellow pill. It's 1933, and this pill is being advertised as something almost too good to be true. A way to lose weight without changing your diet, without exercising, without any real effort at all. And here's the strange part. It actually worked, spectacularly well. But the chemical inside that pill wasn't developed in a pharmaceutical lab. It was developed for something else entirely, decades earlier, in munitions factories building explosives for World War I. Here's the part that should genuinely stop you. Workers in those factories, men and women who had no interest in losing weight at all, started dropping pounds rapidly, without trying, without dieting, simply from being exposed to this chemical at work. Some of them got dangerously sick. A few of them died. So the question is simple. How did a substance discovered because it was quietly poisoning factory workers end up, just 15 years later, being sold to the public as a diet miracle? And why, nearly a century after doctors first watched it kill people, is it still being sold today? Rewind to 1915. French factories near Avignon and Marseille were producing artillery shells for the war effort, using a yellow chemical compound called dinitrophenol, DNP for short, mixed into the explosive filling. Workers handling the chemical daily started noticing something odd about their bodies. They were sweating constantly, even when the work wasn't especially strenuous. They were losing weight rapidly. Their skin sometimes took on a yellowish tint. Some developed painful stomach issues and diarrhea that didn't improve even after they went home for the day. Nobody had set out to study weight loss. This was simply what happened to people who spent their days around this particular chemical. It would take over a decade before anyone thought to ask whether that strange side effect might actually be useful for something. Reports from these factories describe symptoms that, in hindsight, paint a genuinely alarming picture. Workers' pupils sometimes contracted unusually. Some described what one account later called a burning thirst that never seemed to go away. At the time, factory doctors treated it largely as an occupational hazard to be managed, not a medical mystery worth deeper investigation. Munitions production during wartime rarely paused for careful toxicology studies. By the late 1920s and early 1930s, being overweight had shifted, culturally and medically, into something increasingly viewed as a serious health problem, rather than a simple sign of prosperity. Life insurance companies had begun factoring weight directly into their policies. Physicians were writing with growing urgency about the dangers of excess weight. At Stanford University, two researchers, Windsor Cutting and Maurice Tainter, became curious about that old, strange observation from the munitions factories. If this chemical somehow caused rapid, consistent weight loss in factory workers who weren't even trying to lose weight, what exactly was it doing inside the human body? Their research led to a genuinely fascinating scientific discovery. DNP interferes directly with how cells produce energy. Normally, your cells convert food into a usable energy molecule your body relies on for basically everything. DNP essentially breaks that entire process, causing your body to burn through calories at a dramatically accelerated rate, but releasing most of that energy as raw heat instead of usable fuel. In other words, it didn't just help the body burn fat, it forced the body's entire metabolic engine to run in a way it was never designed to run. There's a detail worth sitting with here. Cutting and Tainter weren't reckless researchers chasing an easy headline. They were following a legitimate, fascinating scientific thread, an accidental industrial observation that led to a genuine breakthrough in understanding human metabolism. In many ways, their underlying research remains scientifically significant even today, studied by researchers investigating metabolic disorders and cellular energy production. The tragedy of DNP was never really about bad science. It was about what happened once that science left the laboratory and entered the consumer market. This is the dark origin, and if you like uncovering the real, often unsettling stories behind everyday history, hit subscribe now. Drop a comment telling us what forgotten scandal or dangerous invention you want us to dig into next, and we'll go find the real story. Once Cutting and Tainter published their findings, DNP spread with remarkable speed. Physicians across the country began prescribing it to patients seeking weight loss. Early reports genuinely seemed promising. Tainter himself reported that the drug appeared effective, with what he described at the time as a very small number of fatalities. For a public desperate for an easy solution, that trade-off seemed, at least initially, worth it. Pharmaceutical companies began manufacturing and distributing DNP products nationwide. Patients could simply take a pill and watch the number on the scale drop without changing a single habit in their daily routine. It felt, understandably, like exactly the miracle so many people had been hoping for. But the same mechanism that made DNP so effective was, by its very nature, almost impossible to make genuinely safe. There was no simple way to speed up a person's metabolism dramatically without also risking their body overheating from the inside, in ways that became increasingly difficult to predict or control from patient to patient. Part of what made this especially dangerous is something doctors would come to understand only gradually. Different people's bodies responded to the exact same amount of the drug in wildly inconsistent ways. A dose that produced a mild, manageable result in one patient could push another patient's body temperature into a genuinely life-threatening range. There was no reliable way, using the medical knowledge available at the time, to predict in advance which patients fell into which category. As DNP use spread through the mid-1930s, reports of serious complications started accumulating. Some patients developed a condition doctors began calling dinitrocataracts, a form of vision damage severe enough in some cases to cause permanent blindness. Thousands of cases were eventually documented. Other patients experienced something far more acute and immediate. Because DNP forced the body to generate enormous amounts of internal heat, some users developed dangerously high body temperatures, a condition now generally described as hyperthermia. In severe cases, this runaway heat buildup damaged vital organs faster than doctors could intervene. There's a genuinely disturbing detail medical researchers would later document. In the most extreme fatal cases, the body's internal temperature rose so high, so quickly, that some victims reportedly developed rigor mortis, the stiffening normally associated with death, almost immediately as they died, an exceptionally rare and telling sign of just how catastrophically their bodies had overheated from within. The drug wasn't simply risky in occasional unlucky cases. It was, by its fundamental chemistry, a substance with essentially no truly safe dose for sustained human use. Physicians prescribing DNP in the mid-1930s were, in many cases, operating with genuinely limited information about just how unpredictable its effects could be. Medical journals of the era published a mix of cautious optimism and growing alarm side by side, sometimes in the very same publication, as the true scope of the risk only slowly became clear through accumulating case reports rather than any single dramatic warning. By the late 1930s, the mounting evidence had become impossible to ignore. In 1938, the newly empowered Food and Drug Administration, acting under fresh regulatory authority partly inspired by earlier public health disasters, declared DNP extremely dangerous and not fit for human consumption, and it was pulled from the legal market for weight loss use in the United States. It's worth noting the timing here. The 1938 Federal Food, Drug, and Cosmetic Act, the law that gave the FDA the authority to actually ban DNP outright, had itself only just been passed, prompted in large part by an entirely separate tragedy involving a poorly tested medicine that killed over 100 people, mostly children, just 1 year earlier. DNP's ban wasn't an isolated regulatory decision. It was one of the first real tests of an entirely new system of drug oversight in America, built specifically because the previous system had allowed products this dangerous to reach the public in the first place. For decades afterward, DNP largely faded from public memory, remembered mainly as a strange historical footnote, a chemical mistake corrected by early pharmaceutical regulation working roughly as intended. But that wasn't the end of its story. Not even close. In the 1980s, a physician rediscovered the original Stanford research papers and briefly attempted to reintroduce DNP as a weight loss treatment through a private clinic. Regulators shut the operation down relatively quickly. Then came the internet. Beginning in the early 2000s, DNP resurfaced again, this time marketed almost entirely online, largely to bodybuilders and people seeking extremely rapid fat loss, often advertised alongside dramatic before and after photos on fitness forums. Because DNP is still manufactured today for legitimate industrial purposes, pesticides, dyes, photographic chemicals, it remains, disturbingly, quite easy to purchase, despite being illegal to sell for human consumption. The same properties that made it lethal in the 1930s haven't changed even slightly. Poison control centers in multiple countries have documented a steady, ongoing stream of DNP-related poisonings and deaths in recent years. Deaths that follow the same underlying pattern doctors first documented nearly a century ago. A body's internal temperature spiraling upward faster than emergency medicine can bring it back down. What's particularly striking is how little the actual danger has changed, despite the enormous amount of scientific and medical progress made in the century since DNP was first studied. Modern intensive care units, with all their advanced monitoring and intervention capabilities, still struggle to reliably save patients once a severe DNP reaction has fully taken hold. The chemistry simply doesn't leave much room for medical intervention once the body's temperature regulation has been overwhelmed. Picture that small yellow pill again, the one you started with. It's worth sitting with how strange this particular story's shape really is. Most dangerous historical products eventually just disappear, replaced by safer alternatives, regulated out of existence, forgotten entirely once the underlying science moves on. DNP didn't follow that pattern. It got banned, it faded, and then, decades later, it came back almost entirely unchanged, sold to a new generation, who in many cases have never heard the word dinitrophenol before encountering it online. Nobody selling DNP today discovered some new, safer version of the chemical. It's the exact same industrial compound French munitions workers were exposed to over a century ago. The same compound that gave Stanford researchers their strange, effective, genuinely dangerous discovery in the 1930s. The chemistry never changed, even slightly. Only the packaging did. Maybe that's worth remembering the next time something online promises a dramatic result with almost no effort required. Sometimes the reason a shortcut like that got banned decades ago isn't a mystery lost to history. Sometimes it's simply because doctors already watched in real time exactly what it does to a human body, and decided quite reasonably that no one should have to find that out again.